You're watching Capitol Connection from the Illinois State Capitol.
Earlier this week, the Auditor General's office released an audit detailing the failures of both the governor's office and the Illinois Department of Public Health in acting on a COVID outbreak at the LaSalle Veterans Home back in November 2020. That outbreak led to 36 residents dying from COVID-19. We're now joined by Senate Minority Deputy Leader Sue Rezin. Thank you for joining us.
Thanks for having me.
All right, so I want to start here. This report changed a lot of the perception of this outbreak from the initial investigation that was held months ago. When you saw the initial details of this report, what did you think?
Well, first of all, the Auditor General's report, which just came out, was done by the Auditor General. He's an independent body, aside from the legislature, who he and his staff took an entire year to go through over 1,800 documents regarding this issue. They actually went into the home to investigate how this outbreak happened. They went through a very meticulous timetable of what was happening in that very crucial 12-day span from November 1st, when the outbreak was identified, to November 12th, when the governor's administration and the Department of Public Health said, oh, we need to do a site visit. That crucial 12 days allowed COVID, which by then had entered the home on November 1st, to spread rampantly throughout the entire home, ultimately killing 36 of our veterans. 30% of the veterans from the Veterans Home passed away. This is the deadliest outbreak in a state facility in Illinois history. And the governor, the governor's administration, and the Department of Public Health was found at fault in this independent report by the Auditor General.
Yeah, so that independent report, obviously different from that initial investigation that led to the Illinois Department of Veterans Affairs director resigning in that. I guess when we're talking about the perception of this event, obviously the governor's office being named directly in this audit, showing those shortcomings. What does this, what needs to happen now from the governor's office, from IDPH, when we're a year and a half out from the outbreak?
Sure. Well, first of all, I think it's important to understand what happened here. From the onset of the outbreak, I started receiving whistleblowers calling my cell phone on Friday night saying there's something happening at the LaSalle Veterans Home with a massive outbreak, and many people are sick and with cross-contamination and not enough PPE to protect the people who work there and also the veterans. So that raised alarms for us. But what happened is, from there on, we asked the governor and his office to come in and help with the outbreak. The administration has had the opportunity from the very beginning to say, you know what, we should have responded quicker. Once the outbreak was identified on November 1st, that's when, by definition, the outbreak was identified. And the problem is they did not respond with an on-site visit until November 12th, almost 2 weeks into the outbreak. And what happens is, once the Department of Public Health and the governor's office and then the Department of Veterans Affairs did an on-site visit, they saw that there were many procedures not being followed, that there was not enough PPE, that many of the procedures, although some were followed, but many were lax. So that created a massive outbreak. We asked the governor and we pushed the governors for hearings to see exactly what happened. At first, nobody wanted to have hearings about this issue. Finally, after enough pressure from my colleagues across the aisle, they had hearings. Then we asked for an independent report by the Auditor General. The governor and this administration responded with a report that was done by an employee from the governor's office. He worked for the Inspector General of the Department of Human Services. This is an appointment from the governor's office. And for the first report, it was very narrowly defined, meaning they were only going to look into the Department of Veterans Affairs. Well, obviously there were shortcomings in the Department of Veterans Affairs. And, the governor asked for the resignation. But what did not happen in that first sham report was a full investigation about communication between all departments and the governor's office. And that's exactly what we found in this independent report from the Auditor General that we were just given showed that the brunt of the blame lay at the governor and his administration's feet and the Department of Public Health, who, by the way, were receiving almost daily updates by this chief of staff of the Department of Veterans Affairs at the very beginning regarding this outbreak. And the Department of Public Health and the deputy governor did nothing. They did not offer any assistance or advice on how to slow the spread in the facility. They did not provide additional rapid tests, which were being requested by the chief of staff of the Veterans Affairs. And the Department of Public Health and the governor's office were not helpful in providing antibody treatments despite being requested. So that's what this report shows. And it shows that there was no transparency from the very beginning. The governor, his administration, and the Department of Public Health truly dropped the ball and just created this, the deadliest outbreak in a state-run facility in Illinois history. It could have been slowed down. This could have been averted.
Back during the Rauner administration, the Quincy Veterans Home saw an outbreak of Legionnaires, and that was a big problem for the Rauner administration as they went into the 2018 election. Governor Pritzker was very vocal in criticizing the Governor Rauner's role in trying to stem that outbreak. This week, we heard a lot of Republicans quoting Governor Pritzker from back then when he was on that campaign trail and applying what he said then to what happened now with this COVID outbreak.
Well, here's the deal. When Governor Pritzker was candidate Pritzker, when we had the Legionnaires outbreak at the Quincy home, which was a terrible outbreak under a different administration, then candidate Pritzker says, this would have never happened under my watch. Well, here we are, fast forward, not only do we have an outbreak at the LaSalle Veterans Home, we have the largest outbreak ever to enter in a home. Had the Department of Public Health and the governor's administration simply implemented the recommendations from the Auditor General's report that was done after the Quincy outbreak, then the Department of Public Health and the governor would have done a timely on-site visit once the outbreak was identified at the LaSalle Veterans Home. The outbreak was identified November 1st. According to the recommendations, you should do an on-site visit within 2 days of a defined outbreak. That did not happen. This administration waited almost 2 weeks before doing an on-site visit. Not to mention, they didn't offer any advice or assistance to a chief of staff who was from the Department of Veterans Affairs, who was sending almost daily updates about this outbreak. Or the Department of Public Health and the governor's administration did not provide additional rapid tests for the home, which would have allowed us to identify the outbreak in a very speedy manner versus waiting 3 to 5 days. And then also, the administration did not help and provide antibody treatments despite being asked repeatedly by the chief of staff of the Department of Veterans Affairs. Clearly, there's been a complete breakdown in communication from start to finish on this. This administration was not, they're in charge and they did not respond. And because of it, we've had this large outbreak.
Just earlier this week, the latest polls on the Republican primary election for governor were released, and we saw Richard Irvin having just over a 4-point lead over Darren Bailey, largely a 2-person race in that Republican primary, according to that poll. I know a couple of months ago you had a press conference with Jim Durkin talking about your support for Richard Irvin. I wonder what your initial thoughts were when you saw that poll.
Sure. Well, there's a lot of money being spent on this poll, not only to get out what the information on each candidate. I support Richard because he is a mayor who has governed and has accomplishments as the mayor of a very large city in the state of Illinois. Many of the other people in the race, I know them, they're my friends, but I want somebody who can govern from day one and understands what that means. So that's why I support him. But there's a lot of money that's coming in from other entities that, speaking of the Democrat Governors Association, the DGA, that are running these negative ads against Richard because they look at him as the strongest candidate. And you don't see those negative ads as much towards the other candidates. So, there's no question, there's a huge, large segment of population who has not made their decision yet. About 35%, I believe, is what the polls say. People are starting to pay attention now. And as they continue to make their decisions, that gap will continue to close. But clearly it is a two-member or a two-person race for governor. The primary is important, but at the end of the day, we need to play and understand who can win a general in November. And there's one candidate that can win the general in November.
You said there's that large number of undecided people. That number is very considerable and could be the deciding factor in this race. How do you claim that last part when we've already seen Richard Irvin, flood the airwaves with commercials and fill people's mailbox with mailers? The name recognition's there. How does he claim that last chunk of the voter base?
Sure. Well, Richard's touring the state as we speak. He's meeting people. I think his closest opponent has been campaigning for well over 2 years. He has a very solid base. I don't believe his base is going to grow anymore. While in the meantime, Richard's introducing himself throughout the state. Many people in the suburbs are still undecided. And as we all know, the suburbs are kind of the battle for what happens in the state of Illinois. That's where many undecideds are. And they may not feel the same. That's a challenge that we have in the state of Illinois. They may not feel the same as the downstate people who live downstate, but I think you're going to continue to see, once people really start paying attention and understand that there is a primary coming up in June, which is the first time in many, many years that we've had a primary in late June. It's usually in March, that they will see that Richard most aligns with their beliefs, and also will recognize that he has the ability and he has the tenacity and he has the experience it takes to govern in a very large, divisive state. And he does have accomplishments as the mayor of Aurora.
All right, Senator, thank you so much for joining us this week. That will do it for us this week on Capital Connection. For full versions of our interviews, you can find them on our website at WCIA.com, as well as our Capital Connection social channels. We hope to see you next week as well. For Capital Connection, I'm Cole Hank. Stay connected to the Capitol all week. Follow us on Twitter at CapConnectIL, or watch reports from our Capitol team on WCIA3. You can also find us on Facebook or WCIA.com.